and I thought it to be just a joy. But others are worried, though. What do you think about these issues surrounding puberty being front and center in a film like this?
I think that it's really important to realize that this is a Disney Pixar movie. So it's adorable, it's cute, it's cartoony, it doesn't touch really the topic of periods, though it is one of the best quick, like 3-second discussion where they throw down some pain meds, vitamin B12, warm packs, and all these different types of maxi pads that women have to go through. Though I did notice they omitted tampons, which is my pet peeve, particularly with Asians, Blacks, Latinas not using tampons as much as Caucasians do. And I think it's a great way to open up this discussion, prepare your young people for this discussion, and normalize this discussion.
Well, what do you think is the potential harm when these conversations are not happening, when they are not normalized, if you will, and kids don't talk about it before it happens to them?
So I do think the red panda is a great analogy or euphemism for puberty, in that it's this change and she gets stinky and she's embarrassed about it. And the parents are like, oh no, we didn't think it was going to happen this soon. And it's like, yeah, puberty adrenarche, which is the start of stinky armpits and potentially hair, starts at 8. Periods start on average in the United States at 12, 12 and a half, but some young people may start at 10. And so for this movie to show her, quote, puberty starting at 13 is actually when we work her up for delayed puberty. So there should have been many signs before 13 years of age that puberty was going to hit. So I think it's really important to discuss it, because particularly with periods, and again, this movie was not about periods, it was about stinkiness and interest in boys and the separation of, you know, your own individuality from your parents. But if you don't talk to a young person who might have periods, when they get it, they actually think they're dying or something's wrong with them. So please, please talk to your young person.
Wow. You mentioned that, you know, kids could potentially get their periods really early, like, you know, 9 or maybe even 8. So how do you even begin to talk to a kid that age? I guess at different ages, you would have a different type of conversation, maybe go a little deeper into it, more layered. So kind of walk us through what's appropriate for each age group.
Yes. So what I really love, and this was about a Canadian young girl, is they have sex ed starting as a kindergartner, and they have it every 2 years. Even in liberal California, we only have it like around 4th or 5th grade, and then maybe around 7th or 8th grade, and then one more time in high school. But at least we get it in before most young people will have their period. So if you have an 8-year-old, you know, especially if you just have a uterus and you bleed, don't hide your menstrual products. It's a natural thing. Just like they watched you pee and poo and wipe yourself, let them know that once a month you have a bleed, and these are the things that happen. And when this happens to you, when you get older, it's just natural and normal. So it's really important to talk about it, prepare, normalize it. And I love that California passed a law that I believe starting in September, all public schools have to carry free menstrual products. Because as I like to say, yes,
they didn't have that when I was a kid in school.
Paper, there should be free menstrual products, because otherwise we with uteri are just going to take the toilet paper and turn it into a menstrual product, and it's not going to be pretty. My public service announcement I want to put out there, though, is that the #1 cause of missed school and work under the age of 25 in the US of A, not just third world countries, but our country, is painful and heavy periods. So some people, because it runs in their family, they're like, oh, it runs in my family, it's normal. If you are missing school or work because your periods are horrible or your periods are just painful, please see a doctor and know that we can help you with that. Even if it, quote, runs in your family, you don't have to suffer.
Yeah. By the way, this is not just about periods, right? Because May was also embarrassed about her feelings for Boy, that convenience store clerk that she dismissed like the day before. And suddenly she was like, what's going on? And she's drawing lovey-dovey pictures of them. And all those are things that should be part of that conversation, right? But I want to ask you, though, one thing I hear parents talking about, they wonder, you know, when you talk about these difficult things, right, whether it's sex, drugs, your body changing, or suicide, they might put ideas in your head in such a way that they'd be more likely to try those things. True or false? What do we know about that?
I always believe that knowledge is power. And if you give people, the benefits and the cons of every situation, then they will see it. Like one thing I like is the sexually transmitted infection disease manual. Look, you don't use a condom, this happens. You don't use prevention when you're having sexual relations, you get a baby. And this is a screaming, crying baby that you have to breastfeed every 2 to 3 hours and change its diapers. And that will be your responsibility from now until you die. So it's putting out those realities and talking about sex has never been shown to cause sex. And in fact, comprehensive sex ed, such as we have in California, has prevented sexually transmitted infections and prevented unplanned pregnancy. So don't be afraid to talk about this. But if you don't feel comfortable, there are great resources out there. We have Health Connected, a nonprofit in the Bay Area that teaches comprehensive sex ed, Planned Parenthood.
All right, we'll have to continue that conversation over on Facebook Live. But Dr. Sophia Yen with Pandia Health, thank you so much for all that wonderful information. We'll be right back.
Baby got back.